And hello, it's noon. Actually, it's 2 minutes past. And that is because we've been having technical difficulties again here in the office. Some of you know we've got our O2 chair, and so we've been doing some things with that, and it's working, but we've got some peripheral things that just don't seem to want to work with it. And I've been like in and out with good customers all day long, so I'm a little out of breath and whatnot. But I just want to share with you, this is my lifesaver today. This is Southwest Allergies, and the pollen outside is horrific. It is green. Everything is green. And so I started coming down with some postnasal drip yesterday that was irritating my throat, and it was like, oh, this is not good. So I started to take this little spray, and it is awesome. I am symptom-free. My throat doesn't hurt. And so if you are dealing with allergies, this little beauty here is great. It's 3 pumps in the mouth, $26. I mean, it's just not bad at all, and it keeps you symptom-free. So yippee, yippee. Hey, Denise. Hey, Sandy. Thanks for joining. I'm not sure who all else is there. I can see I've got more people than I'm actually seeing, but that's what happens with Facebook. So today, I want to talk to you about some different weirdness, right? Just different weirdness. So in the Huffington Post, hi Kyle. In the Huffington Post, they have an article, and I think this was a little while ago, and it says, sorry mom, getting lots of tattoos can have a surprising health benefit. Hey Vivian. Now, at the very bottom of the article, if you read all the way to the bottom of the article, the purpose says, Lynn hopes that this study reduces the stigma associated with getting inked up. Quote, we'd like to take tattoos out of the negative subculture niche of bikers and sailors and risky behavior. So this is his defined purpose in this article. So this was published actually in the American Journal of Human Biology. And it says that people that get tattoos have a healthier immune system, right? So we know that that's not true. Why do we know that? Because, hello, Stephanie, thanks for watching. We know that because the human body, its main number one defense mechanism is the skin. So anything that you put underneath the skin bypasses the number one immune function of the body, which is your skin. So the inks at the tattoo parlor have not been tested for purity and that kind of thing. There are some heavy metals in there. There are some dyes in there. People are allergic to them. We know that tattoos fade over time. Why? Because the liver is our big filter, and it is in charge of the skin. The liver will pull the ink through the body in order to detoxify it and get rid of it. So we know that. So I was interested in looking at this article to find out what they were saying. So basically what they did is they took people that had multiple tattoos, and they took people that it was their virgin time to get a tattoo. And what they found was that people who had multiple tattoos had a better immune response, which means they did not have the inflammation and different things that the novice had. Now, why is that? Well, there's a lot of reasons why that is. This doctor, okay, she is with the Alabama, doesn't say exactly where she is, but she's a medical doctor in Alabama, right? And she says she specializes in preventative medicine. So she specializes in making sure that your immune system is kept strong. She says that the study used a small sample of subjects and investigated only a couple of many substances involved in the immune response to the body. She says, and this is a quote, I would not encourage anyone to get a tattoo for the sake of the immune system benefit. Getting a tattoo carries significant risk, including infection, scarring, and potential adverse psychological effects. It is unlikely that these risks outweigh any boost to the immune system response. Okay, so Lynn, who is the guy that did this study, let me see if I can see. Okay, this was a study at the University of Alabama. Okay, 29 volunteers. And it doesn't say what this man's credentials are, so I don't have that for you. What he's trying to do is just get us not to be judgmental for people that have tattoos. Now, I'm not judgmental. I think it's not a safe health practice, and so we don't advocate it. But we have people that come in here all the time that have tattoos. And so what we tell you is you need to be very, very proactive with the liver to make sure that as the liver does its job to detoxify the inks and the heavy metals and that kind of thing, that you're supporting that, right? And that you're not doing any other kind of risky behavior that's going to harm the liver as it detoxifies you. So that's kind of what we want to do. So the University of Alabama study looked at the immune response to tattoos. However, they did not compare it to existing research on different techniques such as vaccines or any other kind of thing that you inject beneath the skin. So it's not definitive that this really is a sound study. And like I said, the intent was to try and make tattoos more of a mainstream thing. Well, I think they are mainstream. I mean, we have people come in all the time that have tattoos, and I don't care. You know, all I care about is the immune system issue. So, other weird news. Okay, so this was a study done by the University of Texas. And of course, all of us here in Texas love the University of Texas. And so this study, now this is for, well, it's not just women, but you'll get the gist of it. This is the title of this study. Frequent pubic hair removal is linked to increased STIs. So, just giving you this information, right? U.S. study found that people who frequently wax or shave their pubic area report a greater history of STDs, sexual transmitted diseases, okay? According to research, those who frequently remove their pubic hair have an 80% higher risk of getting an STD. So this is from the Dell Medical School at the University of Texas. And the study said that both men and women, okay, so it's just not a women's issue, both men and women report alarming rates of grooming. Now, I didn't know that you could overgroom, right? But apparently in this area you can. So I'm not making a value judgment here. I'm just letting you know. We used to have a massage therapist. She doesn't work here anymore, but she used to when we were at our other location, and she would do a Groupon Brazilian wax, and the women that would come through, I mean, it would just be a steady stream. So I know this is a very popular thing. What I don't know is if they know that they're opening themselves up for a greater incidence of STDs. So what it says is, this is Dr. Osterberg, so I guess he's from this medical school. He says there are a lot of possible reasons for the link between grooming and STDs. He says that the grooming can cause micro tears in the epidermis, which can potentially allow viral and or bacterial penetrance for transmission. So, if you do this, and again, this is not a value judgment, just understand that in some way you are opening yourself up for sexually transmitted disease. 80% higher increase. So this study was actually published in the British Medical Journal, and we all know that that's a pretty, they have very stout requirements to publish things. So, it's interesting. The results are not conclusive. We need further research. And what they said was they would want to have another study that is more scientific as far as test reports, not just people self-reporting. Now, I can just tell you, if I go to the doctor and the doctor tells me that I have an STD, then if I'm answering some kind of a survey and my doctor has told me that I have an STD, right, I'm going to answer appropriately. So I don't think self-reporting, I don't think people are going to report that they have an STD if they don't have one, right? So I think that self-reporting is okay in this. But I just had no idea that this kind of practice could do that. Now, this is just interesting, right? After we adjusted for age, number of sexual partners, and after we adjusted for age and number of sexual partners, we found that those people who groom frequently, as well as those people who remove their pubic hair on an average of 11 times per year, are at 3.5 to 4-fold increase risk of a history of sexually transmitted infections. So, and these infections include the herpes virus and the HPV. So, interesting research here. Like I say, they have extreme groomers. Okay, an extreme groomer, which was 17% of the people, remove all of their pubic hair 11 times a year. Right? 11% are deemed high frequency groomers, which trimmed daily or weekly. So I don't really know what all this means. I'm just kind of old fashioned and, just everything needs to be the way it was, but interesting research. So the other thing I wanted to talk to you about, because we've had many people come in the last couple of weeks who have done a lot of self-diagnosis. Some of them have been to professionals. I mean, we had people that came in last week with a picnic basket. Now I'm thinking Yogi Bear and Boo Boo, the picnic basket, right? They came in with a picnic basket full of supplements that this poor woman, when I put them on my desk, and my desk is probably 4 feet by 3 feet. I mean, it may be 6. Well, it's this big. My arm reach is how long my desk is. And she put out all of her supplements on my desk. And I looked at her and I said, how are you able to take this many supplements? And she said, well, that's one reason why I'm here. I'm not feeling any better and I'm taking all this. And it's like, well, that's really just not a good idea, because your body can only do so much at one time. And so what I wanted to talk to you about is having a professional on your team. Now, obviously, I would like to be that professional, but it doesn't have to be me. But I do want you to have a professional. Why? Because your body changes every 30 to 45 days. So you might come in here and we might assess you and we might say you need XYZ supplements, never 20, okay? Maybe our most intensive program is about 7 supplements, and people need to take that if they're very, very sick or if they're older and their body's just not communicating properly. So we would never give anybody 20 different supplements to take in a 30-day period. The main thing is the supplements that we give you in that 30-day period are strong, they are potent, they are given at a therapeutic dose, which means they are going to change your body in 30 days. And so unless I specifically say I want this to work for 60 days or I want this to work for 90 days, we want you to understand that at the end of the protocol, which is going to be 30 to 45 days, depending on how often you take the remedies, your body is going to change. You're going to need different things. And so when you don't employ the benefit of a professional, you're really just stabbing in the dark. A lot of times people will come in and they'll say, I've been doing this, I've been doing that, it's not working for me, what is wrong? Well, when they come in for an assessment, we look at the body and we see what the body is doing. We had a man come in today, and he's not an old man by any stretch of the imagination, but his vibrational frequencies were very, very minimal. Now, what does that mean? Think of an orchestra. If you have in your orchestra, you've got your woodwinds, your clarinet, your saxophone, your oboe, that kind of thing. You've got your wind instruments, your piccolo, your flute. I'm going brain dead here. Flute. You've got your trombone. You've got all your brass. Brass is what I was looking for. You've got your percussion. You've got your strings. You've got all that. They all have to be tuned at the right frequency. They all have to do their sounds. Their sounds are all individual depending on what kind of musical instrument they are, right? And so they've got to be tuned so they work together. So the symphony is very euphoric. Everything sounds really good, and it's fabulous. So let's take that analogy and go into the body. You've got a respiratory system. You've got a circulatory system. You've got a lymphatic system. You've got a renal system. You've got a hepatic system. You've got a central nervous system. You've got an elimination system. All these different systems are like the different sections in an orchestra. They all have to be tuned. They all have to work at the right frequency so that the body, which is an organic compilation of these systems, has the frequency that it needs to maintain your health. Now, Hippocrates said, let your food be your medicine and your medicine be your food. So we very much advocate holistic living, holistic food. We very much advocate organic foods. So this is one of your first line of defense. But our food is not at the level that it used to be. So from the 1960s, and here we are in 2018, from the 1960s, we stopped doing strip mining, we stopped doing crop rotation, we stopped doing a lot of those things. That date may be kind of arbitrary, but go back in the history and look. We're not farming the way we used to, so our soil is depleted. It has been proven that organic fruits and vegetables have 40% more nutrients than your fruits and vegetables that are not organic. Why is that? A lot of reasons. Organic farmers replenish the minerals in the soil, and they pick the produce when it is ripe. When you have industrial farms, they are treating the land with different chemicals and synthetic things, and they're picking the produce when it is still green because they want it to survive transit, and then it gets to where it needs to be, and they gas it. Even though they do that and it looks ripe in the grocery store, because it's been picked green, it is acidic. We don't want our bodies to be acidic. We want our bodies to be alkaline, okay? So we want to eat alkaline foods. So food is our first line of defense. When you come in with supplements that are not vibrating at the right frequency, they're not going to do you any good. So we had a gentleman that came in today, and he sent me an email yesterday, and he said, Dr. Polly, I'm very frustrated. I have been seeing this professional. I've been doing some things on the internet, and he sent me his protocol sheet. Now, his protocol sheet had several different remedies on it. It cost him $900 per month, which is absolutely ridiculous, right? He was working on a problem that had been, it should have been resolved within 90 days, and we had been working on this since September. So it's September, here we are at the end of March. So that's probably, 7 months, 8 months maybe. And so just not working for him, and that's a lot of dollars. Now, when we did the EAV testing on the products, we found that most of the products that he was using were not at the therapeutic level to help him get his body to work correctly. Now, part of that is because all of his frequencies are low, but part of it was because the products didn't have the right frequency. They weren't at the therapeutic level that they could do the job. So lots of hundreds of dollars poorer and no richer in health. This is why you need a qualified professional that has the tools that we use to check frequencies. Everything has a frequency. Everything alive has a frequency. Everything that is in a made in a chemical, so like your prescription and that kind of thing, it also has a frequency. We want to make sure that everything vibrates at the right level so that you can have what you need. So this is why we do what we do. We don't want you going on the internet and reading some bogus things like I told you about this tattoo thing. We don't want you reading that and then going out to Amazon. Don't be buying your supplements on Amazon. We talked about that before. Amazon, and I have somewhere on the internet, you'll have to search it, but Google Amazon counterfeit products. Just Google that. A lot of the herbs and supplements that you're getting from internet sources, you're getting old products that people have bought, they've stored incorrectly, they've lost their potency, they're not going to do you any good. So you want to be buying your enzymes, your herbs, your homeopathic remedies from a reputable vendor, somebody who has a personal relationship with the vendors. We know how they're made, we know where they're made, we know when they come to us, how long it's going to be to get here. In most cases, of course, the post office sometimes doesn't work with us, but we have this relationship with our people, so we know where they are. We know what we need to do for that, and so we're going to only give you things that are going to work. You're not going to be spending hundreds of dollars and not getting anywhere, okay? There are a lot of protocols out there, and we've talked about this before. Essential oils are not to be taken internally unless you are being monitored by a medical professional. Now, not only that, but the medical professional needs to have insurance that says, if I give you essential oils internally and you have a bad reaction, I have insurance that's going to pay your medical bills, right? I don't know of anybody that has that, right? So this is according to the American, I'm going to get all this wrong, but it is the American Aromatherapist Certification people, those people. That's what they say. Do not take essential oils internally unless you're being recommended by a medical professional who has indemnity insurance that they will pay for you if you get sick by taking these oils internally. Essential oils are very volatile. I heard of somebody taking oil of oregano internally. Oregano oil is very volatile. It will absolutely eat up the mucosa lining in your gut. And I'm not just talking about in your stomach, but I'm talking about the small intestines, large intestine, in your mouth, in your cheek. It will absolutely destroy that mucosa lining. Then what's going to happen? What's going to happen is you're going to get what we call passive leaky gut syndrome, right? That's where, think of my hand as your smooth lining and your intestines, right? So what's going to happen is that essential oil is going to poke holes in that. So when you eat something, it's going to go right through, right, into the bloodstream. You're going to have an allergic reaction. You're going to have an immune response. And that means the body is going to look at that food that God meant to nourish you, and it's going to look like it is an allergen. The body's going to mount an immune response, and you're going to be sick, okay? It's going to take energy away from healing and put that energy toward restoration. When that happens, you go through that barrier, then you're going to have a lot of candida and different things, which is exactly what this young man had. So it is very, very important for you to be your own best advocate. We love you. We spend a lot of time looking and discussing and researching so that you have absolutely the best products for your health. As one of my dear friends says, it's the right remedy at the right time, at the right level, and in the right sequence that brings about healing. So when you're doing all of this and you're not getting those parameters in place because you don't have a professional that helps you, then what you're going to be getting is a lot of translocation of pathogens, okay? Now what that means is you might have a virus that's being contained through homeostasis in a certain organ, and when you do a remedy at the wrong time, in the wrong sequence, at the wrong level, you're going to take that pathogen from where it is in a very safe place, and you're going to move it to another place. And I'm thinking of the book, Who Moved My Cheese, right? You're going to move it, and the body has to figure out where it is and mount a whole another way to balance the body. So you're getting the body off kilter. It doesn't have what it needs to heal. So we don't want you to do that. Now, I've only got just a few more minutes, but I do want to give you some progress on our O2 chair. So you saw that last week we had a picture. I had an unexpected, my daughter came in on Friday, I think it was, or whatever day it was. She came in and she took a trial run in it, and she loved it, and everybody so far has loved it. It's very relaxing, but what we're seeing with the HRV, that's your heart rate variability monitor, what we're seeing is your neurotransmitters, that's in your brain, are getting better, that your telomeres, that's how long your chromosomes are. The longer your chromosomes, the younger you are biologically. That is changing. Your metabolic processes. This is your sodium potassium pump working. This is just your body's autonomic nervous system. After you have that oxygen, right? Everything is functioning so much better. And what we're seeing, and we're just 1 week into the trial, what we're seeing is that the benefits hold over from day to day. So that's a good thing. You might not be able to come and do the O2 chair every day, but what we're seeing is that if you do it, whatever time you can do it, there is a longer term benefit because you're getting that oxygen to the brain, you're getting that oxygen at the cellular level, and this is what we want. Most sickness, most disease occurs in an oxygen-starved environment. So we don't want you to be oxygen-starved, okay? So just want to give you that little update. So if you want to come and do this, you're welcome to do it. Call the clinic because we've got to put you on the schedule. And this morning it's been in and out. It's like been a swinging door, in and out, which is lovely. We love that. So we're glad to be able to offer this to the community, and we just believe it's going to be a great enhancement to what we're doing here. So anytime we can get your body talking better, anytime we can get your cells speaking to each other better, anytime we can get that autonomic nervous system doing what it needs to do, everybody's happy. And so we're really, really excited about that. It's not expensive. It's a 20-minute treatment, and it's $30. Now, if you want the biometrics, then that is an additional charge because somebody has to be in there and do all that. So next week is Good Friday. I'm planning on being here with you, but you might not be here with me. A lot of people are off school. A lot of people are doing what they're doing. So I just want to give you the heads up. I'm planning on being here next week, and I'm not sure what we're going to be talking about, so any suggestions are welcome. I want you to enjoy the spring weather. Remember, allergy relief if the pollen is getting to you. We don't want you not to enjoy the fresh air and all that kind of stuff. So I'm going to say goodbye. We love you. We want you to have a good weekend, and I will see you next week. Thanks for joining us.